You'll remember all the way back when an outbreak of coronavirus was first reported in Wuhan, China, back in December of 2019. Well, now an independent panel has found the world did not react quickly enough in the weeks that followed, and if it had, the pandemic could have been prevented. The Right Honourable Helen Clark is the co-chair of the Independent Panel for Pandemic Preparedness and Response. She also served as New Zealand's Prime Minister, and it is a pleasure for us to welcome her now to the program from Auckland. Helen Clark, thank you very much for joining us this morning, your time.
Thank you. Thank you.
There is a lot in your report, but certainly one thing grabbing headlines is this idea that the pandemic could have been prevented. How so?
What we found was that there were failures, gaps and delays all along the chain from the time that the doctors in Wuhan first got the samples from the patients with this unknown pneumonia tested. They reported it to their authorities. A bulletin went out publicly from Wuhan on the 31st of December, but then it wasn't until the 23rd of January that Wuhan was locked down. And of course, by then, the case had already cropped up in Thailand. People have been traveling for the Lunar New Year very widely and so on. We also find that the information shared with the WHO by China was quite limited initially, that the sharing of the genome sequencing took more than a week to be shared. All this is vital information. Then the international health regulations somewhat constrain the WHO. It doesn't give it much power. When it finally did make the international emergency declaration, not enough countries took enough notice of it. And so we identify the month of February as a lost month of opportunity where there could have been aggressive measures put in place to stop the spread, and they weren't. And when the pandemic word was finally used, countries started to wake up, but it was too late.
It was too late by that point. You raised the point that China was not sharing information initially. Does China share some of the responsibility for what ultimately happened because of a lack of transparency, particularly at that early stage, about what was unfolding?
Yes, it does. I mean, clearly, if there had been more information available more quickly and the lockdown had come more quickly in China, there would have been a better chance of containing it. What when you look at it is quite odd is that one of China's most eminent people declared on Chinese TV on the 20th of January that there was human-to-human transmission. But even then, that didn't seem to register with the emergency committee convened by the WHO, which is supposed to make recommendations on these major global emergencies. And we say that could have been declared 8 days earlier than it was. There was clearly evidence of human-to-human transmission. We think that WHO could have acted in a precautionary way earlier than the absolute confirmation, because you're dealing with a respiratory pathogen which has the potential to travel far and fast. So all of this is very frustrating, as is the relative lack of action by most countries around the world in the month of February till things got really bad.
It was a year ago, of course, when then President Trump was facing a lot of criticism about his response, but he also said that the WTO should have done more. He said it failed to adequately obtain, vet, and share information in a timely and transparent fashion. Was President Trump right?
Not on that. I mean, WHO shared what it was able to, but it hasn't got the power under its these regulations to be able to share information from a country without the country's permission.
That doesn't seem right.
No, it's not right. And so here's the rub. Look, we haven't in our report, we've set out what happened. There is a very detailed chronology. We have layers and layers of information here, and it speaks for itself about where the delays are at every point. What we've focused on is not casting blame, but on saying what needs to be fixed. And what needs to be fixed is the WHO needs more powers. It needs to be able to immediately access the site of an outbreak to make its assessments. It needs to be able to immediately publish information that comes to hand, not have to wait for a country's permission. It needs the clear authority to act in a precautionary manner where there is a pathogen loose, which is a respiratory one, which clearly carries pandemic potential. It needs clear and transparent criteria on which the public health emergency of international concern will be issued. Incomprehensible, as I say, that the emergency committee did not act at the first point. So we want to liberate the WHO from its constraints. We also make recommendations about its financing. It's been kept hand to mouth. You have to feel sorry for the WHO. Its people have worked overtime to try to deal with this, but the operating environment they were in doesn't help them.
I am struck by what you're saying, that the WHO needs to be able to very quickly get into a place where an outbreak is transpiring. And yet, even after everything that's happened, it strikes me that China would, even today, not be welcoming immediately to a WHO team poking around inside its country.
Well, here's the rub, that the changes we recommend are going to need to be agreed to. So there's not a lot of point in us slamming this one or slamming that one or the other. We've identified what the problem is. We want it fixed. The world needs it fixed, and countries are going to have to negotiate that. So our call for them is to get on with that. To set up the new Pandemic Framework Convention, to strengthen the international health regulations, to get the Global Health Threats Council, which is an oversight council, in place, to get the financing mechanism in place. There's so many things that have to be done, and countries are going to have to agree on it.
Helen Clark, we really appreciate your time today. Thank you.
Thanks.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.